Hi, my name is Rhett. This is the respiratory assessment. I'm going to start by just looking at her general appearance. It appears that while at rest, her breathing is regular and her rhythm is regular. I'm going to go ahead and assess her breaths per minute. I'm going to ask her to breathe normally. And her breaths per minute is 16, which is appropriate for her. I don't hear any audible wheezing. Her skin tone is appropriate for her ethnicity. I'm going to look at her trachea here. I don't see any signs of deviation. In palpating it, I don't feel any deviation either. I don't see any signs of cyanosis. Her lips are good and pink, and they look well perfused, as well as her nail beds are good and pink, and her cap refills less than 2 seconds. Looking at her neck and above her supraclavicular areas, I don't see any signs of accessory muscle use or retractions. Looking at her chest on all sides, her chest looks good and symmetrical. I don't see any lesions or deformities. Her looks like that her AP diameter is half of her lateral diameter, so that's a 1-to-2 ratio, which is appropriate. And then her chest and her posterior area they're symmetrical, and her respirations appear symmetrical and unimpaired. I'm going to go ahead and move to palpation. So what I want to do is I'm just going to palpate her chest and her posterior wall, and every time I move to her posterior, she's going to cross her arms in front of her. So I'm palpating for any pain, any tenderness, or any masses. Any pain there?
No.
Okay. Okay. So moving on from there, I'm going to test for her chest expansion, and what I'm going to have her do is sit on the edge of the seat, and I'm going to turn her just a little bit so you can see. She's crossing her arms in front of her, and I'm going to place my hands across the margin here. I'm going to ask her to take a deep breath. Exhale. My thumbs move apart simultaneously, and so her chest expansion is symmetric. I'm going to go ahead and perform a test for tactile firmitus. So what I'm going to do is I'm going to lay my hands on her chest and her back, and I'm going to have her repeat the number 99 each time I lay my hands on her.
99, 99, 99, 99, 99, 99.
Okay, the tactile firmitus is a normal intensity, and there was normal intensity, normal vibration. So I don't feel like there's any areas of consolidation, fluid or air in her lungs. We'll go ahead and move to percussion now. So what I'll do is I'll be hyperextending my middle finger, and I'll be percussing her anteriorly and posteriorly, just listening for a good sounding resonance, which indicates a good healthy air-filled lung. Okay, good resonance there. Like I said, it sounds like a good, healthy air-filled lung. I'm going to go ahead and assess her diaphragmatic excursion. So I'm going to have her sit up just a little bit. And cross your arms in front of you there. So what I'll do first is I'll have her exhale, hold her breath. I'm going to palpate down to dullness. After that, I'm going to make a mark. And then I'm going to have her inhale, hold her breath, and then I'm going to palpate to dullness, measure between the two marks, and that'll give me my measurement. So if you would, please exhale, hold your breath. that. Okay, you can breathe normal. Now please inhale and hold your breath. And it looks like about 4 centimeters. I'm going to go ahead and repeat it on the other side. Please exhale and hold your breath. Okay, you can breathe normal. Now please inhale and hold your breath. And it appears to be about 4 centimeters as well. So her diaphragmatic excursion is appropriate. We're going to go ahead and move to auscultation now. I'm just going to listen to your anterior breath sounds, your posterior breath sounds. I want to make sure that all of her breath sounds are appropriate for each location. Her vesicular breath sounds are normal in the peripheral areas, and then her bronchovesicular sounds are normal for the major airway areas. Being sure to note that there any wheezing, rhonchi, or crackles, and again, normal intensity and pitch in their appropriate locations. So she'll be breathing through her mouth. As I touch the stethoscope, she's going to be taking a deep breath. Please cross your arms for me. Okay, her lung sounds are appropriate for each location. The intensity during inspiration and expiration is appropriate. No rhonchi, wheezing, or crackles. I'm going to go ahead and move to some additional consolidation tests. The first one, I'm going to be listening to her lung sounds, asking her to repeat the word Scooby-Doo. This is called bronchophony.
Scooby-Doo. 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 Scooby-Doo.
Please cross your arms.
Scooby-Doo. 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 Scooby-Doo.
All right, bronchophony is good. The test is normal. Now we're going to move to egophony, and I'm going to have her repeat E, and I'm going to see if make sure there's not an E to A transition as she says that. So I'm going to go through the same motions.
E, 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 E.
Okay, her egophony test is appropriate. The last one is a whisper test. So I'm going to have her whisper 1, 2, 3, and I'm going to listen to her in all the areas. And it should be faint and barely, it should be barely audible.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1,
All right, and her whisper test is appropriate. And one other thing I meant to mention too is while listening to her lung sounds, if I feel that she had any congestion, it's called a post-tussive test. I could have her cough, listen to her lung sounds, and make sure to see that, like, if the congestion was contributing to the adventitious breath sounds. But that concludes our respiratory assessment.